So first off, I am Sarah Scranton. Welcome. I'm the Executive Director of the Arthritis Foundation of Michigan, and I'm joined today by my colleague, Courtney Durbin, who's the Executive Director of Northeast Ohio. We're both excited to have you and are excited for our presentation today. The webinar will be recorded and you will get it in a follow-up email from the Arthritis Foundation in a few days. So please make sure to look for that. Anyone who registered will receive a link so that you can go back and watch the presentation. You're all muted right now, and we really invite you to stay on mute as we go through the presentation to limit background noise and distraction for the speakers. But we would love to have you stay on camera. As I mentioned earlier, it's so nice to see friendly faces when you're on this side presenting. So please stay on camera, but keep yourselves muted. A few other items, just if you're not familiar with Zoom, you are able to change your viewing options so that you can either see all of those who are here with us today or watch the slides on the presentation. And you can do that by going to the top right corner of your screen and clicking on the view button. We also have had a lot of questions submitted prior to registration, and we will be answering those immediately following the presentation. However, if you see that a question you may have is not in the chat, you're welcome to put that in the chat. And to do that, if you hover at the bottom of your screen, sort of in the middle to the left, there's a little bubble and it says chat. If you click on it, the chat feature will come up and you can type your question in there. So if you're unfamiliar with the Arthritis Foundation, or if it's been some time since you've utilized our resources, I just wanted to give a quick announcement. We are the nation's leading organization that is dedicated to finding a cure while conquering arthritis. And we do that through life-changing resources, community connections, and scientific research. We exist to serve you, the arthritis community. We're here to offer you support in all areas through your arthritis journey, and look forward to doing that as we advance treatments. So to start today, we're proud to also be partnering with one of our main partners, Meijer Specialty Pharmacy, on this educational program. It's something that we've been looking forward to for a long time. We've actually had a lot of success with these types of programs throughout the year, so we're planning to keep them as we move into 2022. And you can all help us inform the topics we discuss by taking a short 10-minute insight survey from the Arthritis Foundation. That will also be included in the follow-up email that you receive from us. I'd also like to take a quick moment to thank our Arthritis Foundation sponsor, Horizon Therapeutics. You'll find more information and details about Horizon in the follow-up email as well. So with that, it's my pleasure to introduce Kevin Morgan from Meijer Specialty Pharmacy. Take it away, Kevin.
Thanks, Sarah. Hi, everyone. Thank you for supporting the Arthritis Foundation and for attending this special event. As Sarah mentioned, I'm Kevin with Meijer Specialty Pharmacy, and I have with me today two of our experts to answer your questions as they relate to diet and medications. Beth is our registered dietitian nutritionist, and she'll be discussing diet specifically as it relates to rheumatoid arthritis. And Katie is our pharmacist, and she leads our clinical programs with Meijer Specialty Pharmacy, and she'll be discussing medications. At Meijer Specialty Pharmacy, it is our goal to ensure that you can get the specialty medications you need at a reasonable price. So we work with your doctor's office and your insurance through the prior authorization process. We can ship the medications to you at no cost, or you can pick them up from your local Meijer if that's convenient for you. While you're there, you might want to stock up on some healthy ingredients for what you're about to learn from Beth. But to kick things off with the discussion on medications, please welcome Katie.
Thank you, Kevin. And thank you everyone so much for joining us today. We're so excited to be here and to talk to you a little bit about rheumatoid arthritis and how to live well through both nutrition and medication. Now, if I could just get someone to give me a thumbs up to make sure that you can see my slides right now. Fantastic, thank you. My name is Katie Wenstrom. I am a board certified specialty pharmacist and I lead our clinical programs through Meijer Specialty Pharmacy. With me, I have my colleague, Wilston. She's a registered dietitian and a nutrition education specialist with Meijer Specialty Pharmacy. Now, to get us started, I just want to cover a little bit of background information about rheumatoid arthritis, or RA, and inflammation. So to start, RA, it is an autoimmune disease. And what that means is that it's our own body's immune system that is causing the problem and attacking our joints. We need our immune system. It does very good work to keep us safe from a lot of the bacteria and viruses and other foreign things that can get into our body and make us very sick. But in an autoimmune disease, that immune system is actually attacking part of our body that is ourselves and not something foreign. When that happens, it causes a lot of inflammation, and that can lead to the painful and swollen joints that patients with RA experience. When the disease is not treated appropriately and high levels of inflammation, they can spread outside of the joints and they can cause problems that affect other parts of the body, like your eyes, your heart, your circulatory system, or your blood vessels, or your lungs, and cause some more severe problems because of that. Right now, there is no cure for rheumatoid arthritis. And I know that can sound scary, but there are a lot of things that we can do, even though there isn't a cure, to keep those symptoms at bay and to help you live a full life, even with this diagnosis. And when we talk about treatment, the goal here is to stop inflammation, or at the very least, to reduce it to the lowest possible level. When we do that, the first and foremost thing you're going to experience is your symptoms reduced. You'll have less pain in your joints. When you have less pain and swelling in your joints, it'll improve your function. You can use those joints better than you normally would, and it can improve your overall well-being. When we keep inflammation low as well, we can prevent damage to the joints, and we can also prevent those long-term complications that I mentioned. So problems with other organs in your body, like your lungs or your blood vessels. There are a lot of ways that we can work to reduce inflammation. First and foremost, I'm going to hand it over to Beth, and she'll cover how to reduce inflammation and manage RA through nutrition.
Hi, everyone. Like Katie mentioned, my name is Beth Eggleston. I'm a registered dietitian and a nutrition education specialist with Meijer Specialty Pharmacy. I'm so excited to be here today to talk to you about the relationship between nutrition and RA. You'll see a question posed on the screen: why does a healthy diet matter? And I, as a dietitian, am always going to talk about how awesome a healthy diet is, but it's particularly awesome for those with RA. Now, as a dietitian, it would be unethical for me to come on a presentation like this and say, hey, if you eat this one food, or if you eat this one diet, you are going to have all your RA symptoms go away and you're never going to have to experience RA again. That's just not how it works. But what I can say is there are patterns of eating and different foods you can include and perhaps take out of your diet that might help to tip the scales of RA symptoms in your favor. One thing I really want to address today is an anti-inflammatory diet. And I don't even like the word diet. I would like to say an anti-inflammatory pattern of eating. When we eat in this way and include certain components to our diet, that can help reduce the pain of rheumatoid arthritis. So one of the major things that you can do to help prevent the inflammation of arthritis is to choose more whole foods. And what are whole foods? They're foods that have little or no processing or in their most natural state. So it would be things like a chicken breast instead of a hot dog, or old-fashioned oatmeal instead of Lucky Charms, maybe a piece of fruit instead of fruit punch. All of these are going to be considered whole foods. When we choose more whole foods, we automatically are going to have a more balanced and plant-heavy or plant-forward diet. And when we have a lot of plants in our diet, we are going to have way more fiber as well. And that's going to have implications for our gut health. And we're going to talk about that a little bit later in the presentation too. Some examples of whole foods include fruits and vegetables, lean meats, fish, eggs, whole grains, nuts, and seeds. Beans also fit within that category as well. And a simple rule that you can follow when you're at the grocery store is staying on the perimeter of the grocery store when you're shopping. That's when where you're going to find the majority of your whole foods, like your fruits and vegetables and your lean meats and eggs. If you do venture down the aisles, that's where you're going to find your whole grains, nuts, seeds, and beans. Other great things you can find in the aisles include canned and frozen fruits and vegetables. We always tout, eat fresh produce, but there are lots of really wonderful reasons to eat canned or frozen. If you're choosing canned, make sure you're choosing canned fruits that are packed in water or 100% juice. Canned vegetables, you want to rinse out in a colander just to get rid of any extra sodium, and choose frozen fruits without extra sugar and frozen vegetables without any cream sauces or a lot of added salt as well. Another component to eating in an anti-inflammatory diet pattern is to consume healthy fats. Now, I could talk to you for an hour about fats. I love fats as a dietitian. And if you look at the food label, you'll see lots of different types of fats on there. But what I want to hone in on are those anti-inflammatory types of fats. And those are going to be our omega-3 fatty acids and our monounsaturated fats. Omega-3 fatty acids are found in several different food items. First and foremost are smash fish. And this is just an acronym for salmon, mackerel, anchovies, sardines, and herring. And you can see that listed at the bottom of the slide. Other sources of omega-3 fatty acids include walnuts, flaxseed and flaxseed oil, and chia seeds. If you're not huge into fish, it's okay, I get it. You can also choose a fish oil supplement. If you do choose to do that, I would recommend talking to a pharmacist, your physician, or a registered dietitian about the amount and type that's right for you. Monounsaturated fats are another type of really wonderful anti-inflammatory fat, and they're found in things like olives or olive oil, avocados, nuts, and nut butters. What I want to stress with these healthy fats is it's important to consume them, but another important piece of this is to replace our less than healthy fats with our omega-3s and our monounsaturated fats. So, for example, that would include our saturated fats and our trans fats. And I'll talk about that a little bit more in the presentation. But some good, easy, everyday tips that you can follow include if you're going to have beef or pork several days a week, that's going to be pretty high in saturated fat. So instead of having that every day, maybe switching out and having a serving of fish 1 or 2 days a week. If you use butter in your skillet when you're making food, perhaps switch that out for olive oil. Just easy switches to consume more of those healthy fats. Another key piece to an anti-inflammatory diet is antioxidants. Antioxidants help prevent inflammation because they help to keep cells safe and healthy. There are these things floating around in our body called free radicals. They can come from food, they can come from the environment, but what they do is they cause cell damage, and that cell damage causes inflammation. Antioxidants help to stop that. There's a particular type of antioxidants called polyphenols. There are over 8,000 different types, and that's beyond the scope of this presentation. But antioxidants are mostly found in plant foods. Actually, they're entirely found in plant foods. You can see a list here of all sorts of foods that are really rich in these polyphenols. One food item that's often touted for arthritis is cherry juice, and cherry juice has a type of polyphenol that is really beneficial for bringing down inflammation. Another easy real-world example of something you can do is just eat the rainbow. When you're eating fruits and vegetables, choose colorful fruits and vegetables: greens, reds, oranges, yellows, purples, whites. All sorts of colors are going to have a different array of antioxidants and particularly polyphenols to help bring down that inflammation. I mentioned earlier I wanted to touch a moment on gut health. Katie mentioned that on autoimmune disease is where your immune system goes a little bit rogue. So, did you know that 70% of your immune system actually lies within your gut? So if we can help to get that as healthy as possible, we can potentially bring down the symptoms of RA because we can bring down that inflammation. 2 items I want to touch on here: prebiotics and probiotics. Prebiotics are actually indigestible fibers that we take in from food or supplements or functional foods that feed the bacteria in our gut. They are the food, the nourishment. They help to make that bacteria healthier. A particular type of prebiotic called inulin actually is very good for those with RA, according to the research. Food sources of inulin include wheat, onions, bananas, leeks, and asparagus. On the flip side, probiotics are healthy live bacteria that live in our gut that have a host of health benefits. But when it comes to prebiotics, or excuse me, when it comes to probiotics, Bacillus coagulans is top-notch for RA. The research suggests that this type of probiotic actually brings down the inflammation occurring with RA. Some food sources of Bacillus coagulans include kimchi, sauerkraut, and yogurt. If you're wanting to learn more about probiotics or wanting to know what type you should take, a really good resource is the US Probiotic Guide, which you see on the right hand of the slide there. You go to that website, they have lots of different information about different types of probiotic, prebiotic, and functional foods. So functional foods are foods that have those pre or probiotics added. And they'll give you the amount that you need based on your condition and your gender. And they also provide all the literature that backs that recommendation. So it's a really, really nice resource available. I talked about anti-inflammatory diets as a diet pattern, but I did want to mention a couple different named diets that may be beneficial for bringing down inflammation as well. First and foremost, we have the paleo diet, and this is where we're just eating like our Paleolithic ancestors. So think Neanderthals, we're all hunters and gatherers in the woods. So some really good sources of Paleolithic foods include a high protein and a high fiber diet. So it's going to be fish, lean meats, fruits, vegetables, nuts and seeds, and healthy fats. What's not included on a paleo diet are processed foods, wheat, dairy, legumes, potatoes, white sugar, and refined oils like canola oil. The Mediterranean diet, if I had to be, put on my dietitian hat here, and since it is already on, I would say this is one of my favorites, is a diet that's rich in whole grains, produce, like fruits and vegetables, legumes, olive oil, and fish. It limits saturated fat, red meat, poultry, dairy products, and processed foods. And finally, we have our gluten-free diet here. And this is where you're just taking out any food that has the protein gluten in it. Gluten is naturally found in wheat, rye, and barley, and their products that are made with these particular grains. It can also be, you can get it from cross-contamination in distribution facilities or where foods are made. But in general, there are a lot of really healthy gluten-free products or foods available, like fruits and vegetables, lean meats, healthy fats. Are you seeing some common denominators here? All of these diets, paleo, Mediterranean, and gluten-free, have those attributes I mentioned earlier. So being very plant-forward, focusing on whole foods, having healthy fats, having lots of produce, all of these things can help to bring down inflammation. Now, this is not a one-size-fits-all approach. What might work for one person may not work for another. So I do want to stress that as we're moving forward. I talked about different foods to include in your diet to help bring down inflammation, but there's also foods that you might want to omit from your diet or potentially eat less often to avoid inflammation. And these are called pro-inflammatory or trigger foods. So one of the top pro-inflammatory foods include different types of unhealthy fats like saturated fat and trans fat. Saturated fats are going to be solid at room temperature. So think butter. Butter is solid at room temperature. That is very high in saturated fat. Animal products tend to be higher in saturated fat, as well as, I'm thinking lard, ice cream, whole fat, dairy products, those types of things. Trans fat, on the other hand, is a man-made fat. Trans fat has been added to the food supply to make shelf life longer and improve the mouthfeel of certain foods. Now, just recently in the last few years, trans fat has been banned from the food supply up to a certain amount. So there's not as much out there as there used to be, but if you are eating processed foods, you are going to be eating a lot more trans fat than someone who's eating a more whole food rich diet. Next, you see on our trigger foods is excessive sugar, and top notch number one food for excessive sugar would be our sugar sweetened beverages. So this would be sodas, energy drinks, sports drinks, sugary coffee drinks, lemonade, fruit punch. I can go on and on. These types of foods can be very, very inflammatory in people. So if I were to suggest removing one type of food or maybe taking out one food or bringing down the amount that you're eating or drinking, it would be sugar sweetened beverages. Finally, I have gluten and dairy on this list. And again, not a one size fits all approach. Some people might find gluten triggersome. Some people might find dairy to cause inflammation, but it does vary from person to person. Another grouping of food may also cause inflammation in some people, and those are nightshades. Nightshades is a class of produce that contains a compound called alkaloids, and certain nightshades include eggplant, peppers, tomatillos, and certain spices. Now, this comes from anecdotal evidence. There's no hard and fast literature saying why, yes, nightshades do produce inflammation in all people. That's not how it works, but some people do find that this grouping of produce causes inflammation. So if you are already inflamed or you're having a lot of RA symptom activity, it might be beneficial to cut out nightshades from your diet for a little while and see how you feel. If you're feeling good, start adding them back in and see if you have any type of reaction. And then you might know if nightshades are triggersome for you. Another grouping of foods that may be triggersome for some people are FODMAPs, and this is another mouthful. This stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. I will test you all at the end of this presentation. If you can say this, maybe you'll get a prize. But FODMAPs are, in a nutshell, difficult to digest carbohydrates. Some example of FODMAPs includes fructose, which is the type of sugar you're going to get in fruit, as well as lactose, which is the type of sugar in dairy products. Some people do find that following a low FODMAP diet helps with their symptoms. This can be a difficult diet to follow because it's an elimination diet. You take out all the foods that contain these types of carbohydrates, and then you slowly add them back in to see if anything triggers inflammation in your body. I would always recommend working with a registered dietitian if you did want to follow a low FODMAP diet. Common high FODMAP foods include things like wheat, certain fruits and vegetables. So for fruit, it would be apples and ripe bananas and pears. Vegetables would be things like leeks and onions and asparagus and Brussels sprouts, as well as dairy products and sugar alcohols. And sugar alcohols are found in sugar-free gums and candies. There are a lot of really, really good resources out there related to FODMAPs. I know that Courtney or Sarah is going to put them in the chat, and they include Monash University, which is a university in Australia that's done a lot of research in this area, and they have a really, really nice app related to FODMAPs. So that's going to go in the chat, as well as a dietitian. Her name is Kate Scarlatta, has devoted her career to low FODMAP diets. And she has lots of great resources on her website. So that's going to be added to the chat as well if you'd like to click on and look through some of those resources. When you have RA, you're probably going to be on several different types of medications. So I wanted to hit on really fast different types of medication and nutrient interactions. If you're on a corticosteroid like prednisone, that can actually decrease the absorption of calcium, vitamin D, and potassium. This is important because all three of these nutrients are really important for healthy bones. And if someone has arthritis, they're more likely to get osteoporosis. So we do want to make sure we're getting enough of these nutrients because prednisone or corticosteroids can really decrease the absorption. Methotrexate and sulfasalazine block the absorption of folic acid, and sulfasalazine also decreases the absorption of iron as well. Finally, penicillamine may increase the need for vitamin B6. So it's very important to keep your lab appointments that your doctor sets up for you because you would just want to make sure that you aren't deficient in any of these nutrients. And if you are, you can work with your physician, you can work with a registered dietitian about perhaps supplements you should take to increase your levels or different types of foods that are rich in these particular nutrients. I want to change course here because I think this is very important. When we live at home or we have RA, it can significantly affect our daily activities, and cooking is one of them. We also know that when we cook at home, as we all have been doing so much over the last 2 years, when we cook at home, we can have a lot more control over what it is we put in our bodies and how well we eat. But with RA, we know that that can hurt our hands and it can be tiresome to cook. So I'm just curious, I would love for you guys to put in the chat what type of cooking tools or kitchen tools in your home kitchen you have found beneficial to help reduce hand strain with RA. Give you guys a second to check out the chat feature. Sharp knives, a blender. Those are great examples. Definitely sharp knives. Food processor, perfect. Wonderful. Katie, if you wouldn't mind going on to the next slide, thank you. So one resource that we have, and I'll talk about where that resource is housed, is adaptive cooking tools. Now, those working in the kitchen might need some different ways to go about things that they used to be able to do in another way. So a couple items we have on here is a rotato peeler, which is a really wonderful tool. It not only peels potatoes, it does citrus fruits and apples and pears and all sorts of things. Vegetable choppers can be really helpful. Jar openers, as well as pot stabilizers, which helps keep the pot still if you need to stir with one hand. Someone mentioned blender earlier on in the chat, but if you haven't used an immersion blender, that's another really nice tool because then you don't have to work with the bulky blender and trying to get it down from the shelf and everything. And then mezzalunas. Someone also mentioned sharp knives. Sharp knives are going to be way easier to cut with than dull knives, but a mezzaluna is just a simple rocking motion to help cut different food items. Another really good example of something to have in your kitchen is an electric can opener. Now, if you're interested in learning more and having more tools and resources like that adaptive cooking tool piece there, I would really welcome you to check out A Healthier You. And A Healthier You is a website at MeijerSpecialtyPharmacy.com that myself and my dietitian partner created with your specialty condition in mind. You can see scrolling through on that little computer there several of our resources and tools. What's really nice about the website is we have tons of recipes that were created for RA, and they were dietitian tested and approved in Meijer's Test Kitchens, or after COVID hit, in our own home kitchens. And all the recipes have RA cooking tips to make them a little bit easier for those who have RA. We also have lots of great downloadable tools and resources. We've got several different cookbooks available on the website as well. And if you're interested and have more questions related to nutrition and your rheumatoid arthritis, I invite you to check out our Meet Your Registered Dietitian page, and there you'll see a form that you can fill out to email myself and my dietitian partner Danielle directly with your nutrition questions in a secure and safe portal. So I really appreciate your time today, and I hope you took away some new information related to nutrition and RA. I also invite you to check out A Healthier You and include it as another tool in your toolbox of RA resources. I'm now going to pass you on to Katie so she can teach you more about medications and rheumatoid arthritis.
Fantastic. Thank you so much, Beth. Great information. I don't know about the rest of you, but I am all of a sudden finding myself very, very hungry. Not sure why. So as a pharmacist, my job and my passion is helping people manage their diseases through medication. So that's what I will be talking about a little bit today for the remainder of the presentation. We heard a lot of great information about how to help reduce inflammation and manage RA through nutrition from Beth. I'll be talking about how to get the most out of your medications for RA. Like I talked about at the beginning of the presentation today, right now there is no cure for rheumatoid arthritis. So what we are trying to do, the best way to manage the symptoms and to reduce long-term complications is to keep inflammation levels low. And one of the best ways to do that is through medication. Now, what I have on the next couple of slides are a few different tips and tricks for ways to get the most out of your different types of RA medications. Now, there are a number of different medications out there for RA, and for everyone who has RA that's on the call, you may be on a combination of them. The two most common ways that we take medications for RA are either through an injection that you do into your skin, or as an oral tablet or capsule that you take by mouth. And so those are kind of the categories that I looked at today and with information I want to share. So we'll start with our injectable medications. Again, many people on this call might be on an injectable medication for RA. The biggest recommendation I give to all of my patients is to make sure that they're rotating their injection sites. Now you might be wondering, what exactly does that mean? How do I do that? The best way to visualize it is to think of your stomach, because most people do inject in their stomach area. Think about your stomach as the face of a clock with your belly button right in the middle. Now, your first time you give an injection, you'll want to inject at that 12 o'clock point on the clock. Then your next injection, you'll rotate and inject at 1 o'clock. And you'll continue to rotate around the clock face, around your stomach with every injection that you give. And that's really because we don't want to inject in the exact same spot every single time. It increases your risk of skin infections and other skin problems, and also can make the area really, really sensitive and painful. So if you keep injecting in the exact same spot every time, it's going to be a lot more painful for you too. Another great way to reduce some of the pain that can come along with some injections is to let your medication come to room temperature before you inject. I will say and give the disclaimer that you'll want to talk to your pharmacist or your doctor before you do this. Most medications for RA can be at room temperature for a little while, but not all of them can. So again, check with your pharmacy and your pharmacist before you do this to make sure that you can do this for your actual medication. But when you leave the medications and let them come to room temperature, it decreases a little bit of the pain and the stinging that can happen when you inject sometimes. Another important tip is to make sure that you're never reusing the needles for your injections. Many of our RA medications come in one-time use packages or one-time use syringes, but some of them don't. Some of them you have to put a new needle on every single time you want to give an injection. And I can't stress enough that you don't want to reuse those needles. And really that's for two main reasons. The first one is that every time you reuse a needle, it does get a little bit less sharp or duller each time. And so if you continue to use the same needle over and over again, eventually it's not going to be very sharp at all, and it'll cause a lot more pain for you. The second reason to never reuse needles is because you increase your risk of infections that way. Bacteria can live in needles, and if you're using the same one over and over again, you can be delivering bacteria right into your skin and cause a pretty nasty infection. The last thing I'd like to tell my patients about is to ask about different options for giving your medication. With rheumatoid arthritis, we know a lot of times your hands are affected, and sometimes that makes it really difficult to hold a syringe and to push a plunger to give yourself that injection. There's been a lot of great technology in the last few years when it comes to medications, the injectable kinds. And many of our medications now have an auto injector option. So it just makes it a little bit simpler. They're usually easier to hold. You don't have to press the plunger all the way in. Typically there's a button that you press and then the pen is automatic and presses the plunger in for you. Not all medications for rheumatoid arthritis have this type of auto injector pen, but if you're finding that it is really difficult for you to use your medication, it's worth a call to your pharmacy to ask if that's an option for you. Moving on, we have some tips and tricks for our oral medications, or those tablets and capsules that you take by mouth. The first question or the first tip is one that I get a question about all the time. And a lot of people wonder it, but they don't really want to ask because it has to do with your stool. I will say as a pharmacist, I get questions about this all the time. Never be afraid to ask your pharmacist about stool questions. And that is that sometimes some medications for RA can actually show up in your stool after you take them. It's actually, the technical term is called ghosting. And how that works is that many of these medications, they have an inert or inactive structure that's used to keep the tablet round, keep it all together in the form of a tablet. Then the medication or the active ingredients are kind of packed around that structure, again, just to keep it all together. When you take that medication, your digestive system will absorb the actual medication piece of the tablet, but that inactive structure part will not be digested and will come out in your stool. So I get a lot of questions from patients saying, oh, I saw this in my stool. Does that mean I didn't get my medication? Do I need to take another? So that you did absorb all your medication that you needed. It's what you see in the stool is simply just that inactive structure piece of the tablet that's not digestible. Another really important tip for oral medications is to make sure that you're taking them at around the same time each day. Doesn't mean you have to take it at the exact same hour, minute, and second every single day. But in general terms, if you usually take your medications in the morning, make sure you take them every day in the morning time. Don't bounce between morning and then evening and then afternoon. And that's simply to help keep a steady amount of medication in your system at all times, which will help decrease your symptoms and keep that inflammation at bay. Your oral medications you can take with or without food, whatever is easiest for you to remember. Though I will say, if you notice that you have some stomach upset or experience some nausea when you take your RA medications, taking with food will help decrease the nausea or the stomach upset with that. And then last, but certainly not least, you do want to avoid storing medication in the bathroom. And that applies to all medications, not just those for RA. Might seem a little bit counterintuitive. I mean, we all have medicine cabinets in our bathrooms, but especially in those bathrooms that have showers, it's the moisture that comes along with it and the fluctuations in temperature that can happen that can affect our tablets and capsules, especially that moisture. It can actually get into your pill container and can start to absorb into the tablets and make the medications not work quite as well for you. Best place to store medication is in a nice, cool, dry spot out of direct sunlight. Another really important part to getting the most out of your medications is remembering to take them. Not all medications for RA are something that you take daily. Some of them are monthly or even every few months. And so remembering to take your medications is going to be a very important part to getting the most out of them. The biggest recommendation I give to my patients is to make sure that you're storing your medication in a spot that you see every day. Myself, as an example, I am a huge coffee person. There is not a day that goes by, whether it's a weekday, a weekend, a holiday, where the first thing that I do isn't go to my coffee maker and make myself a cup of coffee. I'm also a very forgetful person. So the way I do it to keep myself on track with my medications is I keep my medication bottles in the same cabinet that I keep my coffee mugs. So I know no matter what day it is, first thing in the morning, I always go. And when I grab my coffee mug to make coffee, it's a visual reminder. I can see my medication bottles and that reminds me to take them. Same thing if you have to store your medications in the refrigerator, keep them next to your orange juice or your milk or your coffee creamer or something that you see every day as a visual reminder to take them. And a really low-tech way to remind yourself is to just set an alarm. I think every single smartphone on this planet has some sort of alarm function. There's lots of non-smartphone alarms that you can use as well. And for those technologically savvy people out there, there are a lot of really great dose reminder apps for smartphones and tablets that you can look up as well. If you go to the app store of your choice, and if you just type in dose reminder or pill reminder into the search, you'll find a lot of great options with a lot of really cool functionality that you can use to remind yourself also. Drug affordability is a huge thing that can impact how you take your medications, especially for those of you that use specialty pharmacies. Many of our specialty medications are incredibly expensive and have a lot of hoops that you have to jump through to get insurance coverage a lot of times also. And so there are a lot of resources out there that you can utilize to help you afford your medication better. Most manufacturers that make our medications do have some type of program out there, whether it's a copay card to help bring down a high copay for patients, or sample programs for patients whose insurance don't cover the medication or who do not have insurance. Outside of manufacturers, there are a lot of different national groups and foundations that provide grant funding or other funding to help patients pay for high copays or for high medication costs. Really here, the best recommendation I can give is to reach out to your specialty pharmacy and ask for help. I can't speak for other specialty pharmacies, but at least here at Meijer, we have an entire department that is dedicated to helping patients afford their medication. They're well-versed and keep very up to date in all of these different foundations and grants and manufacturer programs, and can work with patients to figure out what they qualify and help them apply to help afford their medication. Lastly here, I wanted to touch a little bit on side effects. Many of these medications do have side effects, especially when you first start medication. That's typically when we see them. Many of them will go away, but there are things that we can do to help decrease the side effects so that you can stay on your medication a little bit longer. The first one I want to touch on is risk of infection. So we know many of these medications, they work on your immune system because it's your immune system that's attacking your joints, that's causing the inflammation to begin with. And so increased risk of infection is a little bit higher with these types of medications, especially your respiratory infections like colds, flu, and even COVID. So the biggest recommendation here is to just practice really good hand hygiene. Wash your hands often. Make sure you're not touching your eyes or your face if you haven't washed your hands recently. When you're out and about, especially nowadays, wear a mask and make sure to cover your coughs and sneezes. Many of our RA medications can also cause some stomach upset or diarrhea. Biggest recommendations there, just make sure you're drinking lots of fluids. Water is always going to be your best bet here. And avoiding any foods that might upset your stomach. So think about really greasy foods or really spicy foods or really heavy foods as well. With diarrhea in particular, you can follow a BRAT diet, which stands for bananas, rice, applesauce, and toast. Those are just very kind of plain, easy to eat, easy to digest foods that can help absorb some of that extra water that you have in your gut when you have diarrhea. Headache can also happen with our RA medications. There are a lot of really great over-the-counter pain relievers out there. I would recommend always checking with your doctor or your pharmacist just to review and find out which over-the-counter pain reliever is the best one for you, because some of them can interact with certain medications or certain other diseases. Injection site pain, we've talked about this a little bit already when we talked about always using a new needle and rotating your injection sites. But another important piece here would be to make sure that you're cleaning the skin area with an alcohol swab each time before an injection. Lastly, and Beth touched on this a little bit also, is that some of these medications can cause changes in your lab values. So things like calcium, potassium, some of your blood cells. And we want to just monitor you for that. So the best recommendation here is to make sure that if your doctor is ordering labs for you, so blood tests for you, make sure that you're keeping those appointments. It's really important for us to look out for those periodically just to make sure that you're not experiencing some type of side effect with your lab values. Now, I'd be remiss as a healthcare practitioner and a pharmacist in this day and age to not give a healthcare related presentation without touching a little bit on COVID and vaccine recommendations. So I do want to cover this just briefly before we end. I will say that this information is always being updated and changing as we learn more things, as more new drugs are approved and new vaccines are approved. So what I am sharing today is updated as of today, November 17th. If you are someone who's listening to this presentation later as a recording, this information may not be as accurate anymore. The best thing to do if you are listening to this after the fact is to follow the 2 links that I have on the next slide that will bring you to very good resources for the most up-to-date information. But as of today, the recommendation is that all patients who have rheumatoid arthritis should be fully vaccinated against COVID-19. It is the single best way to reduce your risk of getting COVID. And even if you do get COVID after being vaccinated, it also is the best way to reduce your risk of serious side effects and hospitalization and death. Can't stress it enough. All patients should be vaccinated. The recommendation specifically for patients with rheumatoid arthritis, for those that are on certain types of immunosuppressive medications, is that you should receive 1 additional dose of the vaccine after you finish your normal series. So the 2-dose series for the 2 vaccines, or the 1-dose series for the J&J vaccine. Again, that's just to make sure that your immune system has gotten the full response out of those vaccines. Additionally, your household members and other people that you are frequently in close contact with should also be vaccinated, not only to protect themselves, but to also help to protect you. And even after being vaccinated, both the CDC and the American Academy of Rheumatology, so the biggest overarching medical group that deals with RA and other rheumatology diseases, they still recommend that you follow physical distancing guidelines even after vaccination. So that still means wearing a mask when you're out in public, staying distant, so 6 feet apart from those who you don't live with. And then when you do go out, avoiding crowds and being inside in poorly ventilated areas when you can. The 2 links that I have listed on the bottom right-hand side of your screen are 2 really wonderful resources that I utilize frequently when helping my patients learn about COVID and the vaccines. The first link is to the American Academy of Rheumatology. So again, kind of the national overseeing group for rheumatologists. And then the bottom link is to the CDC's main COVID coronavirus website for recommendations there as well. That brings me to the end of our presentation. I want to thank each and every one of you for being here today and giving up your time in the middle of the day to listen to us and to hear some tips and tricks about nutrition. I hope you've learned a lot about nutritional ways to manage rheumatoid arthritis and also ways to get the most out of your RA medications. I'm gonna take a stop here. I will hand it back over to Sarah at the Arthritis Foundation, and I believe she has some questions that were submitted to us.
Thank you, Katie and Beth. It was a fabulous presentation. I learned a lot myself, and yes, Beth did make me hungry as well, Katie, when she was going through her presentation. So we are going to start with some questions that have already been submitted, and then we can follow up with any other questions in the chat. If questions don't get answered, we can follow up individually with people as well. And I also just want to put in a reminder that while our panelists today are experts in their own field, they are not physicians, and they'll share their knowledge with you. But if you have any specific medical concerns for yourself, you should seek advice from your healthcare provider. So with that, I'm going to start. And Beth, I think this one might go to you. Are there any vitamins or foods suggested that one takes to limit arthritis pain?
Hopefully, after the presentation, you've got a few more ideas on this particular question, because this was submitted before the presentation itself. But certainly you could do a fish oil supplement if that's something that you're wanting to do. Again, talking to your physician or a pharmacist or registered dietitian about what's right for you, but including some of those healthy fats I mentioned, including lots of fiber-rich fruits and vegetables, particularly of colors across the rainbow is going to be important, and also choosing more whole foods. If you'd like to follow one of those particular diets I mentioned, the paleo, Mediterranean, or gluten-free diet, that might be beneficial too. But again, there's no one-size-fits-all approach to this. It's going to be trial and error. I would just suggest eating colorfully, lots of fruits and vegetables, lots of healthy fats, and it's important to get out and get some sunshine too.
Thank you. Katie, I think this would go to you. Are there any supplements that might provide relief for arthritis pain that you would suggest?
Sure, it's a great question. There are a lot of supplements out there that do say that they help with arthritis pain. The ones that I typically recommend are maybe trying glucosamine and chondroitin. I will say, like Beth mentioned, this is not a one size fits all. It works in some patients, doesn't work in others. And there has been a good amount of research about glucosamine and chondroitin in arthritis, and it's been very inconclusive. There have been studies that have found that it was effective, more effective than placebo or than a pain reliever like Tylenol. And there have been other studies that have found that it was just as effective as a placebo. So I always recommend, it's worth a try if it's something that you feel strongly to try. They are relatively expensive. So if cost is an issue, that's definitely something to take into consideration as well. And then lastly, some of these supplements, they get their glucosamine or chondroitin from shellfish. And so if you have a shellfish allergy, it's really important to look at the label of the supplement that you choose to make sure that it's not made from shellfish.
Great, thanks. So Beth, I'm going to go back to you. Which animal related proteins are less inflammatory?
That's a great question. And what you're going to want to look for is animal proteins that are a little bit lower in saturated fat. So again, I go back to the fish, the smash fish, salmon, mackerel, anchovies, sardines, and herring. Other good examples would be shellfish, except if you have an allergy, of course, Katie. And then things like white meat poultry, so turkey and chicken, as well as eggs can be a little less inflammatory than higher saturated fat foods like our red meat, beef, and pork, things along those lines. Processed meats like ham and bacon and sausage are going to be more inflammatory as well.
Thanks. So Katie, are there any foods, vitamins that interact with common RA biologic medications?
Good question. In general, there are not a lot of foods or vitamins that interact. Other medications is another story altogether that I could give a full extra presentation on. But in terms of foods and vitamins, the biggest one is St. John's wort. It's an herbal supplement that some people use. St. John's wort interacts with just about every single medication that there is out there. It kind of changes how your body processes medications. So that's always my biggest warning is, if you're on any type of medication, I would recommend not taking St. John's wort or talking very in depth with a pharmacist to make sure that that's not a problem for you. The only other thing to look out for, it's not a hard interaction, but any type of digestive remedy, so an antacid, can sometimes affect how your body absorbs your medications that you also take by mouth. So think your tablets and capsules. You can take them together. Usually you just want to separate them out and not take them at the exact same time. But again, in terms of interactions, it's something that us as pharmacists, we get questions all the time. We're happy to answer them. So it's something you can call your pharmacy and give them a list of medications you're on and your supplements, and we can go through and review for you.
Thank you. So here's one I think everyone would like to know, Beth. What are some alternative foods for when you're craving chocolate and sugar?
Well, my sweet tooth trifecta is, and this has actually been studied. I've given this in lots of different presentations and classes I've taught in the past, but it does include that, but it is dark chocolate chips, walnuts, and dried cherries. And putting these together, you have a really nice mix. You get the antioxidants from all three of those foods. You get the healthy fats from the walnuts. And anecdotally, I do this whenever I do have a sweet tooth, and it really does curb the sweet tooth. And it's just a little bit of each, maybe a couple tablespoons of each, and it really can help curb that sweet tooth. As a dietitian, if you're craving sugar, if you're craving chocolate, I don't want to say there's anything wrong with eating a little bit of chocolate, particularly dark chocolate. The darker, the better. An ounce is considered a serving size, so it's not huge, but it can help to make you feel a little bit more fulfilled. But fruit is another naturally sweet food. You could try doing that. If I'm craving a little bit of chocolate, one thing I'll do is maybe make a cup of hot cocoa and do it with a low-fat milk. So there I'm getting a little bit of chocolate, but I'm also getting some vitamin D and calcium as well.
Nice suggestions. So Katie, here's one back for you. Why does my body build antibodies to my medications?
They're all really wonderful questions.
Mhm.
Without getting too in depth on how these medications are made and how they work in the body, I think the easiest way to explain it is that biologic medications, so especially think your injectable RA medications, they're really large, really complex molecules, and they're actually created by living cells. So usually bacteria that we use to create these types of medications. Because they are so large and complex, our immune system can see them as foreign invading bodies. It might see them the same way it sees a bacteria or a virus and can mount an immune response to them. It's usually not as strong as a true bacteria or a virus, but it can start to build those levels up over time. And then you start to see the medications not work quite as well.
Thank you. So we have several questions, Beth, around the plant-based whole foods diet. And there's a lot of different questions. So I wonder maybe instead of going through them all, if you could just talk a little bit about that and maybe give some recommendations for additional resources.
Absolutely. So hopefully after this presentation, you have recognized the importance of eating a diet that's rich in produce and whole foods. So I do think that is going to be really important for bringing down inflammation in the diet. Some nice resources that are available out there that are free are, if you guys are familiar with Forks Over Knives, that's a really nice resource available as a website. There's lots of different cookbooks available with Forks Over Knives. Some other great websites that have recipes on them for plant-based whole foods includes Cookie and Kate is one that I really like. That's a plant-based, all vegetarian food blog, as well as Oh She Glows, another really nice one. So if you are looking for more ideas as to what you should be making or foods to be eating, I suggest those three, and maybe I can throw them in the chat while Katie answers her next question.
Perfect. Thank you. So Katie, here's a question about Remicade. Do the side effects outweigh the benefits for some arthritis patients?
That's a really good question, and it's a little bit difficult to answer. With every medication, there's going to be side effects and there is going to be benefit. In some people, it is possible that just based on other diseases they have, other risk factors, that the potential for side effects would potentially outweigh the benefit that they get for the medication. In that case, there are other options of medications. We're lucky with rheumatoid arthritis. There are a lot of options out there that work in different ways and have different side effects for different people. And so I guess the short answer is yes, but it's always a good conversation to have of the potential benefits versus the potential risks, and making sure you're matching your person as you are with your different diseases and different things you have going on to the medication that will work the best for you.
And this one I'm going to throw out for both of you maybe. Do you have any tips that you'd like to give for how arthritis patients can battle fatigue?
Certainly, eating at regular intervals can definitely help. If you are, you're not feeling well, you don't really want to eat, that can actually make fatigue worse because you can get low blood sugar and your body just needs that fuel that you're going to get from food to have energy. So certainly trying to eat every few hours, and eating a balanced diet. And it seems counterintuitive, of course, but if you're able to get some physical activity, that's going to help with fatigue as well.
All right, thanks. Do you have anything to add to that, Katie?
I was going to second everything that Beth had. Even as a pharmacist, I get this question a lot, and I always bring it back mostly to diet and exercise and making sure, and sleep, making sure all of that is balanced.
Thank you. Well, thank you both. We do have a lot of questions that have went unanswered, but we can follow up after the fact to get answers to some of these. But we didn't have enough time to answer them all, but I think that we all learned some great information. And really one of the takeaways is knowing that you can talk to your pharmacist or a dietitian about all of these questions that you have. Don't be afraid to ask anything, as we learned from Katie. There's no dumb question out there. So what's next? We will be emailing out the webinar, as I mentioned. It will include Meijer Specialty Pharmacy resources. Again, it will include our Arthritis Foundation partner, Horizon Therapeutics, and resources available through them. And we also will include some specific information related to the Arthritis Foundation. I mentioned the Insight survey earlier. Also, our VIM app. It is a great arthritis pain management and tracking app. If you haven't downloaded, I suggest you do. I just want to take a moment and thank all of you for spending your lunch hour with us. I want to thank Beth and Katie for a wonderful job presenting, and Meijer Specialty Pharmacy, as well as Horizon Therapeutics. And just a reminder, look for the email from the Arthritis Foundation with all of the follow-up in it. Thank you so much.
Thank you all.